Trigeminal neuralgia is a neurological condition that causes chronic and severe facial pain as a result of a malfunction in the trigeminal nerve. Now, this nerve is a bundle of fibers that exist at the base of the brain and are responsible for the sensations in the face. Now, this nerve has three unique branches, each of which controls a different segment of the face, and if one branch gets damaged, only that portion of the face it controls will be affected. This is why most people tend to experience pain on either the right or the left side of their face, and not usually both. Classic symptoms can be described as spastic, stabbing pain that lasts anywhere from a few seconds to around 2 minutes, and it's described as a shock-like or shooting sensation. This form of TN can be a single attack in a day, or it can be rapid back-to-back attacks. These cases do tend to go through periods of remission wherein the pain disappears for weeks or even years at a time. The less common version is sometimes called type 2. It's usually more mild but extensive and persistent, whereas with the classic case, you tend to have more focalized pain in the cheek, the jaw, the teeth, the gums, or the lips. With the non-classic TN, patients tend to describe their pain to be more spread out across the face, and rather than electric, their pain is described as burning. Most often, irritation or damage to the trigeminal nerve is caused by pressure being placed on it. This usually happens when an artery or a vein comes into contact with the trigeminal nerve. Most treatments are usually geared towards managing the pain and symptoms. Things like painkillers and anticonvulsant medication are typically recommended in these cases. Now, while it may help temporarily, there comes a point where, as a person's tolerance to the medication increases, the effect of the medication itself starts to decrease, likely because the root cause of the problem has not been addressed. Another option would be surgery. So if it's an artery compressing the nerve, the surgery usually involves a sponge or a small pad being placed in between the two to prevent further irritation or compression. In other instances, the nerves may be partially or entirely ablated or removed. Now, the problem with this is that relief still cannot be guaranteed. There is still a possibility that the pain can return, and sometimes in a form more intense than before. These two options have left many people without hope. However, there may be another solution that offers long-term results.
Upper cervical care is gentle, non-invasive, and non-surgical, and unlike the other two options mentioned earlier, holistic in its approach. And that means it doesn't just address a patient's symptoms, but rather it looks at the patient as a whole, resolving pain by digging into the origins and healing what's gone wrong in the first place. So in the case of trigeminal neuralgia, TN in short, the core of the problem is typically a compressed nerve. Now, granted, there are a number of extenuating cases in which TN is only a symptom of a more serious issue, like a tumor or multiple sclerosis, for example. In those instances, upper cervical care will not solve the TN in and of itself. However, when it does come to the majority of situations, it can. And this is because a compressed nerve in most cases stem from a misalignment or a subluxation, particularly in the top two bones of the neck that we call the atlas and the axis. Now, to explain further, when there's even the slightest shift in either of these bones, a distortion is created in nerve signals. And as we know, abnormal signals make abnormal things. Now, this can happen from an event such as a whiplash or maybe an accident, a slip or a fall, for instance. And even if this happened months or years before the first symptom appeared, the result of this distortion is improper signals being sent to and from the brain, which can lead to pain. Now, with upper cervical practitioners, the goal is to help bring the body back into the natural alignment and balance. When this is done, proper communication between the brain and spinal cord is restored, and this can help put an end to all the suffering. A precise approach is taken to determine the potential causes of the problem. First, specialized x-rays of the upper neck is taken, and this allows the specialist to pinpoint exactly where the vertebra has shifted. Then, with that knowledge, a specific tailor-made correction is done by hand. Now this helps recalibrate the body by aligning the head, neck, and spine back into their natural positions. Keep in mind there is no forceful pulling, twisting, popping, or cracking involved. The movements are always gentle and controlled. After the correction, imaging studies are then done, as well as a nerve scan to ensure that the spine has successfully come back into alignment. Now, as with all healing, the length of time needed for the body's balance to be restored and for pain to dissolve varies based on the person's history and condition. We hope that you found this video both informative and inspiring. And with the 10 to 15,000 new cases of trigeminal neuralgia being diagnosed each year, it is our hope that spreading the word on upper cervical care will work to bring that number down. So if you know someone that is suffering and is sick and tired of being sick and tired, we highly encourage you to share this information. You never know, you might just be saving a life. We hope to meet you in the future and help find the cause of your problems.